Hi everybody, I'm Philip Keiser. I'm the local health authority for Galveston County and the CEO for the Galveston County Health District. You may have noticed it's really hot outside. And in Texas, of course, our summers get very hot, but this summer has been a record breaker. We've had more days over 100 than we've had in a very, very long time. With that, we've seen a lot of heat-related illnesses and injuries. Already this year, just in the months of July and June, we've had to transport over 70 people to the hospital because of heat illness. We haven't had any deaths yet in Galveston County that have been related to the heat, but in Harris County, our neighbor to the north, there have actually been a significant number of people who have died because of overheating. So the real question is, what do you do when it's really hot outside? And how do you avoid getting sick from the heat? And how do you keep from getting your family or yourself from having to go to the hospital or even worse happening? So the first thing is just recognize the reality that it's hot and it's hotter than usual. People that have grown up in South Texas often will think, well, you know, I'm used to the heat because I grew up in this, but this year it's different, so you have to be careful. And the most important thing is to avoid exposure to the heat. So if you can avoid going outside, don't go outside. Stay in where the places are air conditioned. That's the number one thing. Number two is if you have to go outside and do work or do athletics or any type of recreational activity, reserve that for the morning or for the evening when it's not as hot, and then limit your time while you are outside. The third thing is kind of counterintuitive, but it's cover up. Our normal body temperature is 98.6. So what that means is when it's over 99 degrees, you can't rely on the air to cool yourself down. So when we have high temperatures that are in the hundreds for a prolonged period of time, the best thing is to avoid exposure to the sun and avoid exposure to the heat. You've probably all seen movies of people traveling through the desert. They're all covered up. There's a reason for that, and that's because the clothing blocks the sun. You'll see road workers as you drive up and down I-45, and they're all wearing long sleeves. They wear hats. They wear tails to their hats to protect their necks. They wear long pants. Again, the whole idea is to avoid getting exposure to the sun. Not only does it help keep you cooler, but it also helps keeping you from getting sunburn. Now look at me. I have light skin. I get sunburn. But people who have dark skin get sunburn too. Just because you may be Hispanic or African American, that doesn't mean that you can't get sunburn. And when you get sunburn, it also affects your body's ability to cool yourself down. So again, it's very, very important to cover up. And if you're not covering up, please, please, please use sunblock. The third thing is to keep well hydrated. This is very, very important. If you're going to be out, be constantly drinking. As we sweat, we have two types of losses of fluid. The first one is what we call insensible losses. This is just when we sweat a little bit and you don't even notice it. But as it gets hotter, your insensible losses increase, and you can get dehydrated very quickly before you even realize that you've become dehydrated. And then, of course, we have what are called sensible losses, and that's where you're sweating a lot and you get to the point where your body just can't keep up. So it's important to keep drinking while you're outside. It's also important not to overdo it. So don't go outside, get yourself all worked up, and then go chug a gallon of water or a gallon of Gatorade. That's not the way to do it. The way to do it is to be constantly sipping from a bottle of water. It doesn't really matter that much if it's going to be water or if it's going to be some sort of drink that replenishes your electrolytes. The important thing is to keep doing it. And if you're working outside for a prolonged period of time, a really good rule of thumb is that you should be drinking enough that you should be peeing every hour or two. That's right, you heard it on a video. You should be going to the bathroom and peeing every hour or so, and that's how you know you're well hydrated. Having salty snacks can also help, you know, candy bars, peanuts, those sorts of things that also give you a little bit of salt, also can help keep you well hydrated. The important thing is also to recognize the signs of when you've had too much. So there is a syndrome that we call in the medical field heat exhaustion, and that is where your body is working so hard to keep you cool that it starts to give out. You just are exhausted. And you feel exhausted. You feel tired, you're sweating, you may have headaches, you may feel lightheaded, you may have nausea, sometimes people have diarrhea, your skin can start to feel hot to the touch. And then the next stage is what we call heat stroke. And when you have a heat stroke, that's when your body stops making sweat. and people can lose consciousness, and ultimately they can have seizures and die. And so you don't want to get to that point. You want to, when you're having the point where you're sweating a lot, go inside, be hydrated, get away from the sun as much as you can. We've had problems with people having power losses and not having air conditioning. Well, there's lots of public buildings that you could go into. There are libraries. You could probably stop off at your local fire department and just say, look, my air conditioning broke, I'm really hot, can I come in and cool off? Nobody's going to turn you away. People are going to help you out. Go to the store, go to the mall, go to the gas station and play the line games. Do whatever you have to do to get inside and cool off for a period of time. There is a phenomena that we see in elderly people more commonly, and that's chronic dehydration. And so imagine that, oh, I'm on a fixed income, I'm worried about my electric bill, so instead of turning it to 75, I'm going to turn it to 80, or I'm going to turn it to 85. Well, when you do that, what happens is that over time, over days, you gradually, slowly lose fluid, and you can become chronically dehydrated. It can lead to kidney problems, can lead to other problems. And again, there have been some people that have died. There was a couple recently in Houston that died from chronic dehydration and overheating because their air conditioning broke and they didn't want to ask people for help, and they eventually the heat got to them and they were found dead. We want to avoid that with people, so don't be proud. Go ask for help if you don't have access to air conditioning. If you do all these things and just take sensible steps, you can avoid having any problems with the heat. And hopefully this will be over, although I got to tell you, it looks like it's going to be going through the month of August, but hopefully by September we'll start seeing some relief.